Hey, my name is Brittany, and in the fall of 2022, I was the victim of a violent crime, and with that, I had to apply for crime victims compensation, and I've made videos on this page about the crime victims compensation programs in each state in order to help other victims who may not know that these programs exist. Today, I want to talk about another program that I've recently been eligible for and share some information on that. The program I want to talk about today is called Medi-Cal. It is in the state of California, and it's basically California's Medicaid program. About Medi-Cal is California's Medicaid program. It offers no to low-cost health coverage for California residents. It's overseen by the Department of Healthcare Services, and for specific eligibility criteria, it's important to contact your county's DHCS office. Eligibility is decided by income, age, the age of any children, whether you are pregnant, blind, or disabled. Some types of Medi-Cal require info on assets and property. California offers two ways to get health coverage, Medi-Cal and Covered California. Members of the same family may qualify for Medi-Cal and Covered California. You must live in California. You must give income and tax filing information. You do not have to file taxes in order to receive Medi-Cal. And you must provide Social Security number and immigration status. Information status is kept confidential, and it cannot be used for immigration enforcement. So the types of Medi-Cal are MAGI and non-MAGI. MAGI is Modified Adjusted Gross Income. Medi-Cal uses federal tax rules to decide if you qualify. MAGI is also for children under 19, parents and caretakers of minor children, adults ages 19 to 64, non-pregnant people, and there are no property limits on MAGI. Non-MAGI, or non-modified adjusted gross income, is for adults 65 and older, children under 21, pregnant person, parent or caretaker of an age-eligible child, an adult or child in a long-term care facility, a person who gets Medicare, blind or disabled person, and you must report or give proof of assets. How to apply. You can apply any time of the year by mail, phone, fax, or email. The application may take up to 45 days to be processed, and it may take up to 90 days if applying for Medi-Cal based on disability. Within 45 to 90 days, you'll get an eligibility decision letter, also known as a notice of action. How to use Medi-Cal benefits. It covers medically necessary care like doctor and dental appointments, medications, vision care, family planning, mental health care, drug or alcohol treatment, and transportation to all of the above services. If you're approved, you'll receive a notice of action, and from there, you'll have to enroll in a Medi-Cal managed care plan. What is a Medi-Cal managed care plan? It's an organized system to help you get high quality care. Every Medi-Cal managed care plan within each county has the same services. They offer care coordination, referrals, 24-hour nurse helpline, and customer service. Medi-Cal must approve some services before you get them, and you must pick a managed care plan within 30 days of Medi-Cal approval. If you don't pick one, the state will pick one for you. So the Medi-Cal fee-for-service is Medi-Cal pays doctors or care providers, and you'll use this until you're enrolled in a Medi-Cal managed care plan. So Medi-Cal covered benefits include outpatient services, emergency services, hospitalization, maternity and newborn care, mental health services, substance use disorder services, prescription drugs, labs and blood tests, physical therapy, med supplies and medical devices, preventative and wellness services, chronic disease management, pediatric services, and in-home and other long-term care support. How does Medi-Cal work with Medicare? Most medical services will go through Medicare. Medi-Cal provides long-term services and support. There's also a Medicare premium payment buy-in program. This allows Medi-Cal to pay Medicare Part A and B premiums for Medi-Cal members. There's also a Medicare savings program, and this may pay Medicare Part A and B deductibles, co-insurance, and co-payments if you meet certain conditions. That is it for the brief overview of Medi-Cal, California's Medicaid program. If you have any questions, I will post the contact information and the link for where I got this information in the caption of this video. Thanks for watching, and I'll see you guys next time. Bye.